So there's about 126,000 people in Liverpool that are registered as having asthma with their GP. And asthma in the UK, there's about 5.4 million people with asthma. But about 20% have got what's called difficult asthma. So that's a label of asthma and ongoing flare-ups or ongoing symptoms despite being on a good amount of treatment for asthma. And of those 20%, a subset, so overall about 3 to 5% of the total asthmatic population, have what's known as severe asthma, where asthma is the problem. UK-wide, that's about 750,000 people with what's called difficult asthma, so ongoing symptoms and exacerbations and a label of asthma, and about 200,000 people with severe asthma, where asthma is the main problem rather than things that go along with asthma.
When you can't breathe because you don't really know what to do for the best, and just affected me in work-wise because I should have had a lot of time off work, but I didn't. I sort of had to go in when I wasn't well.
The treatment for asthma relies on medication that you take to keep well, and that's really important. And a lot of people don't appreciate that they need to take medication every day with asthma. And it's a hard thing to get your head around. But really taking treatment to keep the inflammation down and preventing flare-ups is the bedrock of asthma management. But sometimes people get flare-ups of asthma, and that involves taking steroid tablets, which are good at reducing inflammation, but have a whole myriad of side effects. Weight gain, diabetes, osteoporosis. And the more you take over time, the greater your risk of getting side effects of taking steroids.
The steroids I found were all right because they sort of build you up. With me, after a couple of weeks, I sort of went back to square one. The only side effect that I have of the steroids, which is I've now got osteoporosis because I had a bone scan recently, and my previous bone scan, my bones were fine. This one showed there was osteoporosis of the spine and the hip. So it's not very good to take all the steroids, but when you're not well, there's not a lot of choice.
I think there's an underappreciation that there are treatments that people with severe asthma can have. And I also think there's an underappreciation of what severe asthma is. So people that are having 2 or more courses of steroid tablets a year and on a lot of treatment for asthma and taking their treatment correctly should be referred to a severe asthma service because they might be suitable for one of these injections. And the job of a severe asthma service is to make sure that we categorize what type of asthma someone has. It's called phenotyping. Make sure that we pin down which specific type of asthma they have so that we can prescribe them the right drug to attack what's driving their asthma. And if we get the right drug to the right patient, it can be transformational.
When I come out of hospital, they referred me for this injection, and I got the first injection on the 19th of May, and then I take it every 4 weeks for the first couple of months, and then every 8 weeks. And since I've been on it, I've been absolutely fine. I've had no, touch wood, no chest infections, no asthma attacks. I've been fit as a fiddle, been able to get back to do my normal things that I do, been able to go back to the gym. I've been fine since I've been on it. I think it's the best thing ever.
What we've been able to do, along with the Innovation Agency and Liverpool CCG, is successfully apply for funding from the NHS England Accelerated Access Collaborative Rapid Uptake Programme network. And what we've been able to do with that funding is in-reach into primary care to try and identify people that on paper might be suitable for biologics. So in Liverpool, there are about 1,400 patients that are potentially on paper eligible for biologics. And 25 practices have run searches that have been designed by the CCG to identify those patients. And about 700 patients have been identified. And so far, kind of 6 months in to the actual getting the project off the ground, we've seen about 400 of those patients. And about 180 we've been able to suggest some changes and send them back to primary care. And about 70 people that have been out in primary care having courses of steroids, taking good asthma treatment that look like they're suitable for these injections that hopefully will be starting because of this work that we're doing.
Well, I did at first. I thought, oh gosh, it's an injection, and make any difference to me, or will it react if I have to have any other injections? And I thought, well, I've got to try it, because if I don't try it, then what else is there? Not being out of breath, being able to sleep fine, can't even hear my chest at all. No, it's just worked for me.
Yeah, it's incredible, actually, just to see the difference we can make to some patients. And there are more treatments coming out, and severe asthma as a specialist commissioned specialty has happened within my career as a consultant. It's fantastic to be able to make that difference, and it's great to actually be able to work with primary and secondary care colleagues to identify people early and make sure people get on the treatment in good time.
Well, I would say to go on it, because anything is worth a try. And to me, it's worked. It's probably not going to work maybe for everybody, but for me, it's worked up to now. And I just think it's marvellous, really. It's took me off the steroids, it took me off the antibiotics, and it's just worked for me, I think. Yeah, I'm pleased with it.